Ilium, known as phalanx in common language, is the expanded fan-like portion on the upper part of the hip bone. So when you stand like this, you can easily palpate the iliac crest over here. The lower part forms the upper 2/5 of the acetabulum. We'll be discussing ilium in a stepwise manner. So I'll be detailing the three borders, that is the anterior, the posterior, and then we have a medial border. Then we have these three surfaces, the gluteal surface, the iliac surface, and we have the sacropelvic surface. So I'll be describing them in detail in my lecture. If we look at the structure of the ilium, first of all, we have this lower end, which is smaller in size, and it almost forms the 2/5 of the acetabulum. It also fuses with the pubis and the ischium. Now, the iliac crest is basically the upper end of the ilium. So let's start with the iliac crest. As I was saying that we can easily feel the iliac crest. It is basically this broad, convex ridge that we're talking about. It has an outer lip and an inner lip. Iliac crest is convex upwards, so it's basically fanning out. The highest point of the iliac crest is lying at the level of L3 and L4. That is, if we can trace it backwards on this diagram, we can appreciate this fact over here. If we trace the iliac crest anteriorly, it ends in the anterior superior iliac spine. Now you can easily palpate this anteriorly, and this is a very important landmark. So if you want to have a better look and a better understanding, you can even palpate your anterior superior iliac spine right over here. And somewhat over here, you can palpate the iliac crest that we're talking about, which is basically the fan-shaped structure. Now coming to the mid-inguinal point, which is calculated halfway between the anterior superior iliac spine and the pubic symphysis. You can easily palpate the femoral artery over here, which is very important if you want to carry out the arterial blood sampling, for instance. Now, the midpoint of the inguinal ligament is a point between the anterior superior iliac spine and the pubic tubercle. Again, you can perform a lot of procedures such as the inguinal surgeries for herniations after getting to this particular point. Now we have another important landmark, which is known as the posterior superior iliac spine, which is marked by a dimple 4 centimeters lateral to the second sacral spine. Now, first of all, we'll be explaining the borders of the ilium. The anterior border is charting from the anterior superior iliac spine, and it runs down below the acetabulum. There is this shallow notch there, and you must have noticed that we have these two spines located over here. One is the anterior superior iliac spine, and then we have the anterior inferior iliac spine on this anterior border. The posterior border starts at the posterior superior iliac spine. As you trace down, there is the posterior inferior iliac spine, and is followed by a deep notch, which is known as the greater sciatic notch. Now, why is this notch important? It basically transmits a lot of structures from the pelvis to the gluteal region. And as the name is indicating, it's also transmitting the sciatic nerve. Right now, just remember, along with that, we have the gluteal vessels and the nerves being transmitted to the femoral and the pelvic region. The medial border can be seen on the inner surface. It is a short border and ends at the auricular surface, which is named due to its resemblance with the shape of the ear, and it articulates with a similar surface on the sacrum. So let's summarize all the borders that we have discussed so far. First of all, the anterior border, which is facing towards the front side. Then we have the posterior border present at the back. And then we have the medial border, which is facing towards the midline of the body. Now, coming to the surfaces, we have a gluteal surface, which is the outer surface, and an inner surface, which is known as the pelvic surface. First of all, let me show you the gluteal surface, which is basically an irregular surface, convex in shape in front and concave behind. So we have these three distinct lines on the gluteal surface. First of all, the posterior gluteal line, which is the shortest, starting from the posterior superior spine and ending at the posterior inferior spine. Then we have this anterior gluteal line, which is the longest, and it begins about 2.5 centimeters behind the anterior superior iliac spine and ends at the border of the greater sciatic notch. And lastly, we have the inferior gluteal line, which starts behind the anterior superior iliac spine and ends at the apex of the greater sciatic notch. Talking about the sacropelvic surface, remember we have these three distinct points to focus on. First of all, the iliac tuberosity, which is basically a roughened surface, and we'll be explaining its function in detail as it attaches a lot of pelvic muscles. Then we have this auricular pitted surface over here, which forms the sacroiliac joint with a similar surface on the sacrum. And interestingly, it gets its name by the shape of the ear that it has. There is this preauricular sulcus just inferior to it. It exists in varied lengths and widths. We can also trace an arcuate line, which is also known as the line of Douglas, on the sacropelvic region, which is basically a demarcation where the internal oblique and the transversus abdominis aponeurosis of the rectus sheath starts to pass anteriorly. Coming to the pelvic surface. Now the pelvic surface, which is smooth and is lying antero-inferior to the auricular surface. Its function is to form the lateral wall of the pelvis. Present on the pelvic surface is this concavity, which is known as the iliac fossa. It is forming the lateral wall of the cage of bones that we are talking about. So this is the cage of bones that we are continuously referring to, formed by this pelvic girdle anteriorly, and then we have this sacrum posteriorly. I'll be discussing the muscular attachments on the ilium as they involve and they allow a lot of muscular movements at this pelvic girdle, as well as the ligamentous attachments to the ilium. The anterior superior iliac spine gives attachment to the lateral end of the inguinal ligament. It's also giving origin to the sartorius muscle and is extending the whole way down the notch as well. I'll be explaining the attachments on the iliac crest on two sides, as it is an elevation. So we have an outer lip and an inner lip as well. The outer lip gives attachments to the fascia lata in front of the tubercle. Secondly, it provides insertion to the external oblique muscle in the anterior two-third and origin to the latissimus dorsi behind the highest point of the crest. At the tubercle, there is attachment of the iliotibial tract, which is basically a condensation of fascia in the thigh, and it also gets its attachment over here. Now coming to the inner lip of the iliac crest, which is almost 5 attachments that you have to remember. First of all, the origin of the transversus abdominis in the anterior two-third. Secondly, the attachment of fascia iliaca and transversalis. Thirdly, the origin of quadratus lumborum in the posterior one-third. Let me tell you, this particular muscle gets its name due to the almost square shape that it possesses. Finally, we have the attachment of thoracolumbar fascia. Now let's consider the iliac crest to act as a defense force. It's even shaped like a shield, ain't it? Imagine there's been some sort of a street quarrel going on, and the investigating team reaches on the crime scene. To help you remember the attachments provided by the iliac crest, let's remember this mnemonic. The investigating team quarrels too furiously. The T stands for transversus abdominis. I stands for iliaca, which is basically the fascia iliaca. T stands for fascia transversalis. Q stands for quadratus. And lastly, the T and the F stands for the thoracolumbar fascia. Super easy and much needed to grasp that chunk of information. The internal oblique have two main jobs. It counteracts the diaphragm so you can exhale like this when you're breathing out. And secondly, it allows you to bend and rotate from your torso. So basically, when you're working out, you're using a lot of your obliques. Coming to the dorsal surface or the gluteal surface, it gives origin to the gluteus maximus on the lateral side and the erector spinae on the medial surface. The gluteus medius gets its origin between the anterior and the posterior gluteal lines, while the minimus gets its attachment between the anterior and the inferior gluteal lines. Talking about the glutes, we are referring to the buttock muscles. Let me share you the fact that this team together includes the gluteus maximus, gluteus medius, and the gluteus minimus. Together, they form the largest and the strongest muscles of our body to work against the gravity. For instance, even the climbing of the stairs would require their proper functioning. Now, a few fibers of the piriformis would get its attachment from this portion of the greater sciatic notch. And it's basically this pyramidal shaped muscle that I'm referring to. Below the inferior gluteal line is the origin of the reflected head of the rectus femoris. And the straight head gets its origin from the anterior inferior iliac spine. The iliac fossa gives origin to the iliacus from its upper 2/3. The iliac tuberosity gives attachment to the interosseous sacroiliac ligament in most of its part. The dorsal sacroiliac ligament posteriorly and iliolumbar ligament superiorly. The pelvic surface gives attachment to the obturator internus, although there are some ligamentous attachments over here as well. The preauricular sulcus provides attachment to the lower fibers of the ventral sacroiliac ligament, and just lateral to it originates the fibers of the piriformis. So these are all the muscular attachments and the important ligamentous attachments on the ilium. So far, we have discussed the ilium, the important anatomical landmarks on the ilium, and basically the muscular attachments as well as the ligamentous attachments that are found over here. So I hope now you're well versed with the anatomical features of the ilium. And if you have any queries or questions regarding it, you can comment down below.